Hello, hello. I am Dr. Joi Freemont, Miss Dr. Lady. Yes, that's me. I'm a real person. I'm here today to give you Miss Dr. Lady's tips for your teeth. I know it feels like it's been a while, but here I am. Boom, here I am. Hello, hello, hello. If you're here live with me, say hey, hey, hey. Hey, y'all, hey. If you're here live, give me a little live. Say something down below in the comments. Just say live. And if you're catching this on the replay, it's all right too. Go ahead and put replay down in the comments, all right? So I'm Dr. Joi Freemont, Miss Dr. Lady, right here in Atlanta or Hateville. It's the same thing. Hey, Lakeisha. Thank you for coming on my live today. And I'm here today to give you one of the most common dental myths that I hear all the time. As you know, well, if you did not know, I am a dentist now for 27 years. Can you believe it? Yes, 27 years I'm here, and I know a little bit about teeth, just a little bit of something. And I see patients all day. I'm a practicing dentist. I do have an office in Hateville, Georgia, so if you want to come see me, come on, holler at me. I'm at 404-761-1659. You can always click the link in my bio. Listen, we'll get you in. But with that being said, I hear a bunch of lies. Well, I shouldn't say they're lies. I should say that people are misinformed. And unfortunately now with Google, YouTube, all kind of stuff, people tend to go online and they self-diagnose themselves. And unfortunately, that is a big no-no, okay? Although there are several things online that are true, possibly beneficial, you can believe anything you want to believe. And sometimes, unfortunately, it's not true. Or if it is true, it does not apply to you. So with that being said, today's dental myth. Once again, Dr. Fremont, Miss Dr. Lady's tips for your teeth. Hey, that Colgate smile. Love your Colgate smile. So today's tip is, or today's myth actually is, if my gums bleed, I'm gonna stop flossing in that area. I ain't gonna floss over there, it'll stop bleeding. Listen, that may or may not be the best thing for you to do. First of all, because bleeding is a sign of a problem. You don't just bleed all of a sudden, right? If you're flossing every day like you're supposed to floss and you're still bleeding, trust me, there is a problem. Bleeding is a sign of inflammation. Sometimes infection, but always inflammation. Well, unless you cut yourself, right? That's it. But anyway, bleeding is a sign of inflammation and you need to take care of that, right? The most common gum disease, or a common gum disease, is gingivitis. That is inflammation. Also, bleeding could be a sign of a bleeding disorder. Sometimes your gums may bleed because of a side effect of medications you may have. So don't say, okay, I'm going to stop flossing over there. Figure out where the doggone problem is. Sometimes it's built up on your gums or on your teeth, under your gums, that you cannot reach, or something stuck there. Whatever it is, don't just say, I'm going to stop flossing. It's not going to go away on its own. Trust me, it will not go away. Next, you have to become very consistent. All right? You can't floss one day and then not floss the next day. Floss today, then wait 2 more weeks. Floss the next day, then wait 4 more months. Yes, you're going to probably have some bleeding, okay? Because it's an on and off again relationship. Like, you can't call somebody today talking about you're dating and then ghost them for 6 months and come back, hey, how you doing? No, it's going to be a problem. And with your gums, it's the same way. So consistency is the key. If you do not floss every day, meaning every day, eventually it's going to be something very small, it's very tiny, can't even see it, it's going to get stuck down there, it's going to get hard. That plaque's going to turn to hard tartar, and you're not going to be able to get it out by regular brushing or flossing, okay? So keep on, mess around and find out. It's going to happen, okay? And also, when you're flossing, please be gentle. So you're not going there being aggressive, just seesawing. No, be gentle. Your gums are softer than this hard skin you have out here. This hard skin. You cannot go in there and just, okay? You have to floss gently, and you have to brush gently, okay? Use soft, bristled toothbrushes. I tell you all the time, stop it with these hard bristles. The only place that I want you to use a hard or even a medium bristled toothbrush is where you heard me say it, the grout in your shower, okay? It's too hard for your teeth. I wish they would just stop making it. It is not beneficial. Unfortunately, you all think that it's very, very hard. You can scrub, get off. No, but you do not want to scrub. Okay, so Keisha says, if when you're flossing and gunk is on the floss, is it safe to go back in the floss? Go back in if the floss comes out clean. You can go back in, but don't go back in with that same piece of floss that has the gunk. Move it on down the line, okay? You can keep on gently flossing until it comes out clean. Definitely want to keep on doing that. If you see it, imagine what you can't see. So that's a very good question. She's asking me, if you go in there once and you floss and stuff comes out, you can go back in. Just don't go back in with that same piece of floss, that same area, because that gunk that you can see, believe me, underneath all that gunk that you can see is invisible bacteria, and you're putting that back in that same spot. So make sure you use a different piece of floss or different area on that floss to go back in there. So I hope I answered that question properly, okay? I mentioned earlier that bleeding gum sometimes is a different sign of not just plaque and bacteria, but a systemic or overall health issue. You may have a bleeding disorder you might not even know about, okay? Trust me, what you're born with most of the time is going to evolve in what you end up leaving here with. So you have to go get checked out by your medical doctor. Get your regular blood work. Sometimes medications or diseases or conditions creep up on you. You don't even know it's there until you go see your doctor. So if you have a bleeding disorder, that can cause some gum disease, right? If you are on some types of high blood pressure medication, if you have diabetes, if you suffer from epilepsy or have seizures, those things, can cause some issues. If you're pregnant, you have a higher disposition to have bleeding gums. It does not mean it's okay. I'm just telling you that's what it is, okay? So don't not floss to avoid that happening. You have to take better care of it and know your condition so you know how to treat it, okay? Address the issue. Do not overlook it. Oh, it's bleeding. Not a problem. Boo-boo. It's a problem. If you do, then you ignore it and finally come to the dentist, it's a bigger problem because you waited. And yes, it's going to be your fault, okay? Also, diabetes, some cardiovascular, and some respiratory diseases are all linked to gum disease. So make sure that you do not take this lightly. I say it all the time. Your body is a system. What happens here can affect what's happening here, or what's happening here, or even down below. So make sure you know that all things are connected, okay? And finally, stop self-diagnosing yourself. Stop, get off of Google and go to the dentist, okay? I love it some YouTube, but I don't go on YouTube to find out what's wrong with me, because what might be wrong with me may be different for what's wrong with you, okay? So someone has to actually lay eyes on you and touch you and find out what's going on. Do a full, what we call diagnosis, to find out what the problem is, okay? Stop buying these over-the-counter dental picks off eBay, Amazon, and CVS to clean your own teeth. 99.9% of you who are not dentists or hygienists do not know what you're doing, and you're going to cause an issue. I have seen more trauma in people's gums that I've had to reverse and fix because they've gone to CVS to try to clean their own teeth, and you're jacking things up, okay? You can cause some serious damage, okay? Early intervention is always the best way. The earlier we can find out about it, the more likely we are to treat it. Like cancer, the earlier it's diagnosed, the higher chance of survival is going to be, okay? And I said it about 4 times today, do not ignore the problem. Get treated, right? So I definitely want you to debunk the myth that if my gums bleed, I do not or should not brush or floss around there. And that's it. That's your tip for today. Thank you for the questions you gave me. Thank you for coming. Please comment below. Even if it's on the replay, comment down below. Like this. If you're watching this right now, just press the like button right now. Like this video. I'm waiting. Just like it. It's a heart somewhere, a thumbs up, like it, and then share it with somebody who needs to hear it. You have at least one person who ain't been to the dentist. Maybe it's you, or maybe it's your boo. I don't know. Whoever it is, share this with someone and then they will get some knowledge. All right. Once again, I'm Dr. Freemont, Miss Dr. Lady at 404-761-1659, MissDrLady.com. If you have any questions, send down below in the comment section, or if you're kind of scared, just leave me a little message below. No, send me a private message and I'll get back to you. All right. Have a good day and stay safe, and don't ignore the problem. All right. Bye.